the main source of solidarity and assistance doesn't come often from international organisations. It comes from neighbours, it comes from civilians, it comes from people that they themselves may have encountered or lived through difficult situations in the past. And they're the real first responders when it comes to any international crisis. My name is Kenneth Lavelle. I am the Director of Operations for MSF Switzerland. Well, it's nearly 20 years I've been working with MSF, and surprisingly this was my first visit to South Sudan. So for me it was a huge opportunity after all of these years to see the incredible work of our teams. The structural issues in South Sudan have been an issue forever, you could say. There are gaps in the provision of care at community level, primary health care, general health care, hospital-based care. We have seen the reduction in the support provided by other states, by institutional donors. So all of that has an impact on what the government and the Ministry of Health can provide, what other humanitarian actors can provide. Over the last couple of years, MSF in South Sudan has seen some major changes. 2 years ago we saw major clashes in the areas where we were working, and from that point we've had to completely reorganise the activities. So we've set up 2 new interventions. One in what we call the Abyei box in the town of Abyei, where the focus is more on partnering with the Ministry of Health to ensure as much as possible comprehensive secondary level healthcare with, of course, a focus on surgical activities. Now, when we talk about the activities in Abyei further south, there it's more a traditional comprehensive MSF package looking at secondary level healthcare, inpatient capacity, paediatrics, maternity, so a huge volume of activities in a very challenging context. Specifically on the impact on South Sudan, it's evident in the Abyei area and many of the other border areas where you've seen a steady flow of returnees, people that had sought refuge in Sudan many, many years ago because of the tensions in South Sudan are now coming back home. So we are seeing immediate impacts with the risk of food insecurity and nutrition. As the situation in Sudan continues to deteriorate, more and more people are going to be searching for very, very basic assistance and travelling hundreds and hundreds of kilometres to do so. And in the hospital in Abyei, it was a family that had travelled for a woman in that family to be able to receive proper maternal health care. They had travelled days and days and days. They'd travelled through so much of Sudan, no health care. They crossed into the Abyei area, and thankfully there in the MOH and MSF supported hospital, finally they were able to get the care. The local team there were able to go even further, to provide them additional support, because after they'd received the medical care, where were they going to go? I was very, very proud and so happy to see the way that they were welcomed and the way they were looked after by the medical teams, MSF and the MOH and the broader community. They're the real first responders when it comes to any international crisis. And that was very, very nice and heartwarming to see.